Hello, my name is Marina Haydam. I'm a nursing student at Thomas Jefferson University, and I'm currently taking a nutrition course. So I'm looking into how nutrition affects cardiovascular health. And with me, I have my brother Dante.
My name is Dante. I'm a nurse at Upstate Medical University. I work in the medical ICU, where I pretty much treat a lot of high intense patients that come in with exacerbations. And I'm also into endurance sports, so I like to do a lot of running, biking, all that stuff.
So first I'm just going to talk about the background of cardiovascular disease. So it's the #1 killer globally, which makes it very significant, and it's classified by the buildup of fatty plaques in your arteries, which is called atherosclerosis. So this is dangerous because it can inhibit blood flow to tissues and organs, and it can increase your risk of a heart attack or stroke. Several forms of heart disease can be prevented by lifestyle choices. So the choices you make when you're younger can really affect your chances of getting cardiovascular disease as an adult. So risk factors include unhealthy diet, lack of physical activity, smoking, being overweight or obese. So what I wanted to ask you was, what are like the characteristics you see in patients when they come in with the cardiovascular disease?
Right. So most of my patients come in either post-cardiac arrest or some sort of congestive heart failure exacerbation. I think congestive heart failure exacerbation is primarily the one we see, and that is where patients come in with a lot of shortness of breath. It's pretty much when their heart is too congested and the lungs fill up with fluid, therefore they can't absorb as much oxygen, so they come in with shortness of breath, coughing up pink, frothy sputum are the two classic signs. We also see their pro-BNP, which is a cardiac marker that shows how much fluid is in the lungs, essentially, or they can also have an elevated troponin level, which is the ischemic damage to the cardiac heart.
So, in terms of how cardiovascular disease impacts the quality of life, I would say it impacts it pretty hugely, and you would probably agree. Because of symptoms like shortness of breath make it very difficult to perform day-to-day activities. So things like walking up the stairs or going for short walks may be very difficult. So then when this is difficult, it becomes like a negative and unhealthy cycle because you can't increase your physical activity because of the shortness of breath, which makes it very difficult to get out of this cycle. Would you agree with that?
Yeah, so when we see these patients that come in, they can't even get themselves from the bed to the toilet. So it's frustrating, and I know it's frustrating for those patients. So what we like to do is we make sure they don't fall, because that's a big risk for a lot of these patients when they come in with shortness of breath and dizziness as well. So it is frustrating for them, and it's tough on their morals, really.
So in terms of current interventions in nutritional therapy, that would include things like lowering your diet in fat, salt, and sugar, and then also limiting animal fat and protein can be huge. So like red meats, cheese, other dairy products, and then focusing on healthy fats like fish, olive oil, and avocados can be really good. So what would you say is the difference between healthy fats and unhealthy fats, and how much of a difference can this make in your diet?
So healthy fats and unhealthy fats, you have high density lipoproteins, which come from things like olive oil, avocados, fish oil. Those are things really important to incorporate in your diet, especially taking something as basic as a fish oil tablet or having avocado toast for breakfast. Things like that are super important. Topping off all your meals with olive oil help increase HDLs. And what HDLs do is they bring those LDLs, so the low density lipoproteins, that come from the fats, eggs, meats, animal fats, things like that, and it brings that to your liver, where it gets processed through your gallbladder and excreted rather than staying inside of your arteries. So that's the importance of the HDLs. Another thing that we see a lot is putting people on low sodium diets as well as limiting their fluid restriction. That way they don't give themselves the exacerbation going into this congestive heart failure. So with salt intake, your body wants to, water goes where salt goes. So if you increase your salt intake, then your vasculature becomes more filled with fluids, therefore higher stress on your heart. So things like that are important. So what we see is they'll put a lot of people on low sodium diets and fluid restrictions.
So that kind of goes along with current policies. So someone that would come in with the disease, they would talk about physical activity and lifestyle changes, and especially nutritional therapy, because as we just discussed, that's huge. So what would you advise patients when they come in with this issue? Would you go strictly for a nutritional approach?
Right. So there's 3 kinds of preventative action. There's primary, secondary, and tertiary. Primary would be stopping it before it happens. Essentially, that is at an early age, before, let's say, you're 18 years old, where you go see a family practice, and they assess your level, your HDLs, LDL level, cholesterol level, things like that, where they can tell you the recommendations that you need. When they come to us in the ICU, we see them pretty much when they're at their worst. So that's when we implement medications like beta blockers, Lasix, which is helps take off fluid, as well as lisinoprils, ACE inhibitors, ARBs, things that help lower blood pressure.
So there are obviously going to be challenges when trying to maintain this. So I had interviewed Dr. Ronnie Russo, who is a resident of internal medicine, and he said that it takes 60 days to form a habit, which means 2 months of healthy diet and exercise for someone who wouldn't have normally implemented this in their life. So that can be very challenging. But what he says is that even trying to make a 50% difference can be huge and can make a big difference in treating the cardiovascular disease. The other challenge is the socioeconomic barrier. So obviously healthy foods and fresh produce are more expensive than fast food and processed food. So for people that can't afford it, trying to have a healthy diet can be extremely difficult. Exercise and a healthy diet may not be their priority when they're struggling with even feeding their family or putting a roof over their head. So that can be a huge challenge. What would you recommend to someone who may have that sort of challenge, can't afford healthy produce?
Right. So first I'd like to say that it's best to start off with getting yourself into a fitness tracker, like something as simple as a Fitbit, where you can track your steps to make those exercise lifestyle changes. There's studies that show reaching 10,000 steps a day helps increase life expectancy. That's one simple way. Another simple way is I like to follow the 80-20 rule, where 80% of the time you eat and do the right things as far as diet goes, and then 20% you get your splurge of whatever you'd like to have. So as long as you're remaining over that hump of 80-20, or as Ryan said, 50%, I think that's a huge difference in what can prevent you from coming to the hospital. So as far as socioeconomics, there are ways to find healthy produce. Places like Aldi's, Trader Joe's have super healthy options. Switching your diet from low sodium or high sodium to a low sodium diet, staying away from those canned goods, is another way to increase your health life expectancies and decrease cardiovascular risk. Things like shopping on the outside of a store, where you find your fresh produce, things like salads, vegetables, fruits, staying away from high fats like bacon, red meats, going for the turkey bacon rather than the regular bacon. Things like that are big changes that it's tough to make at first, but once you start making those decisions, those habits start to form, and I think that's super important.
So lastly, I just want to ask, would you consider medicine as a last resort, like cholesterol lowering medicine, or would you implement those early on, and like how would they change?
Right. So, for case by case, I know people who come into the hospital with cardiovascular issues at really young ages, and for those people, you want to obviously use whatever will save their life. So, in that case, you have to implement medicine. But if you are proactive about this and you go see your family practice doctor and you have these appointments and you understand what kind of risks you're at as far as socioeconomic and heritage, then I think it's better to make those lifestyle changes early on. Exercise frequently, form a plan, create goals, habits, and I think that's where I would say is the goal forming is the most important thing, especially in a young age.
Yeah, so to conclude, I just want to reiterate that the choices you make when you are young seriously do impact your life later on. So just trying to incorporate these changes like, 10,000 steps or ingesting healthy fats as opposed to bad fats can really make a difference in decreasing your risk for developing cardiovascular disease later on in life.
Well,
So thank you.